Hi, I'm Lisa DeLuca, and I want to talk to you about panic disorder. I see a lot of stuff on the internet, a lot of questions people are asking about panic attacks, how they can stop them or feel better or better manage them. And since panic disorder has been successfully treated for a couple decades now, I just want to put out some information to encourage you to try and find the right kind of help because there is really effective treatment available. Two types of treatment are helpful. One is medication, and the other is cognitive behavioral therapy for specifically for panic disorder. If you do it with a panic disorder specialist, the benefit is clinically proven to be as effective as medication, which is very high. And some people do need to get on medication before they can even engage in treatment because the anxiety is just so high that it's just interfering with their life too much. But some people don't need medication at all. And the kind of treatment that is effective, you should start seeing a benefit within like the first 4 to 8 weeks, maybe a little less, maybe a little bit more. But it's designed to really bring your anxiety levels down pretty early on. So for those people who really don't want to take medication, you don't have to. And I don't recommend, not everybody has to, and I don't recommend doing just medication. Even if you're on medication, I always recommend taking the treatment too, because what the treatment does is it teaches you what you have, why you have it, what you do that makes it worse, and how to stop doing those things, and what you can do to make it better. So it really gives you a sense of more control over your mind and body and a sense of understanding about what is going on in your mind and body, which can be really helpful. So with that said, let me just tell you a couple of places if you're looking for a specialist in panic disorder treatment. One place to try is ADAA.org. It's the Anxiety and Depression Association of America, and a lot of specialists in treating these disorders do sign up with ADAA and are in their directory. Another thing you could do is look for a group practice or a private psychotherapy practitioner who advertises as a cognitive behavioral treatment center. And those centers and practices and practitioners usually are very well versed in anxiety disorders. And if you read their bios, you'll see that they treat a lot of OCD, obsessive compulsive disorder, PTSD, post-traumatic stress disorder, generalized anxiety disorder, panic disorder, and depression, and a lot of these things. So if they're advertising that way, then you know that you're talking to a specialist. Questions that you can ask the potential therapist is, are they using a manual? And that's a really important question. It's manualized treatment, which means that they're using a manual, an actual manual that they will give you. And it doesn't matter which one they use, as long as it's specifically geared to panic disorder. And because they're using a manual, they'll be able to tell you how long treatment takes. And it's usually between 12 and 18 weeks. And if you ask them how long treatment takes and they can't give you an answer, then they're probably not using a manual. So find out if they're using a manual. There's a book out there written by Edmund Bourne, Bourne, called The Anxiety and Phobia Workbook. And the manuals are similar to that. That's also something you could even just buy and use yourself, but self-help is fine and it's great, but it's really not a substitute. Like once you get a professional who's really good, who can help you, it's better because you'd be learning a lot of new skills and things, and sometimes, it takes feedback from somebody else to help you do it the right way. So you want to ask if they're using a manual. You want to ask how long the treatment will take. They should be able to tell you, and it should be, 18 weeks or so. You want to ask them if they're going to teach you desensitization. If you've been avoiding certain things like crowds or supermarkets or waiting on lines or things like that because you're afraid you're going to have a panic attack, then an important part of treatment for you is going to be learning this process called systematic desensitization. And the reason, and what that does is it helps you to stop avoiding these things, and to find a way to do them in a way that is comfortable for you. It's a process of practicing that's in your control. So nobody's going to like throw you in the deep end and say, okay, sink or swim. It's not like that. It's a way to give you control to start doing the things that you've been avoiding. And the reason it's important is because avoidance perpetuates fear. So the more you avoid something, the more that anxiety just stays stuck. So ask the therapist if they're going to be teaching you systematic desensitization, and you can also ask them if they're willing to, or if they're going to work in vivo with you, which is just a fancy, obnoxious kind of word for meaning in real life. So some therapists will actually work with you outside of their office as you go out and try to put these methods into practice in the real world. So for example, if you're afraid of going to department stores with large crowds, they will actually go with you and show you how to do this process to overcome your anxiety. So those are some questions to ask the therapist. Those are some places to find the therapist. And what the treatment is all about, it's very different than what we think of traditionally as talk therapy, where you just come and lay on the couch or sit in the chair and talk about your feelings and what happened during the week. This is different. The therapist is going to be doing most of the talking and teaching, and he or she will be teaching you a bunch of new skills, what you have, why you have it, what you do that makes it worse, what you do that makes it better, and you'll hear that phrase a lot, and they'll be teaching you these new skills, and then there's homework too. So that's another question you can ask, is there homework? Because you're not going to just magically get better by sitting in the office for 18 weeks. The things that they're teaching you, you're going to take home and you're going to practice, and then you're going to come back and talk about it, and they'll give you feedback. And so homework is an important part of it too. So I hope that I've given you just a little bit of helpful information and inspiration to try and get the kind of help that you need and go out there and take control of your life, because it can be better. I don't know you, I never met you, but in most cases, I just do believe that things can get better. It's the things that we talk about that can get better. It's really important, if I didn't say this already, to be screened by your doctor first, because if you're having physical symptoms, panic attacks are in your body, they're not just in your head. It's really important to get screened and make sure there's nothing medically going on, because there are some things like thyroid problems that can cause panic attacks, and things that look very similar to panic disorder. So it's important to get screened medically first, rule out any medical problem. And then just because you're having panic attacks doesn't mean that you have panic disorder. It could be something else. So you would want to seek out a practitioner in the way that I've described, who can properly diagnose you. So good luck, and if you have any feedback, please feel free to leave a comment. I'd love to know, like, if there's anything standing in your way of seeking out help, what that is, and good luck. Feel better and take care.